Hello everyone. In previous lecture, we have started with non-communicable diseases. We have seen definition, and as I said that in this chapter, only four diseases are there which are in your syllabus. That is cancer, diabetes, cardiovascular diseases, and blindness. Now, in first lecture, cancer and diabetes we have covered. In regarding these diseases, as I said, we must know the meaning, their types, their risk factors, predisposing factors, that is the another term, then symptoms and prevention and control. Now, continuing in this chapter, non communicable diseases, the next is cardiovascular diseases. Now, these diseases are also considered as diseases of modern era. That means nowadays modernization is there, and as the lifestyle of the people is very complex, isn't it? So, major causes of death in the developed countries as well as in our country also are due to cardiovascular diseases. Now, in this, there are different types of cardiovascular diseases, but in your syllabus, three types that we are going to cover, that is hypertension, that is high blood pressure, coronary heart disease related to the heart, and rheumatic heart disease. Apart from this, there are other many more complications of cardiovascular system like angina pectoris is there, abnormal heart rate like arrhythmias, then deposition of cholesterol like atherosclerosis, many more are there. But one by one now we will see these three types that are in your syllabus. Now, the first in one is hypertension. Now, hypertension simply we say that is high BP, high blood pressure, isn't it? So, hypertension HPN is one of the major risk factor for cardiovascular diseases. It is called as silent killer. Now, why this hypertension is called silent killer? Because it has no symptoms, isn't it? So, hypertension is derived from the term, that is the hyper meaning high and tension means pressure. So, that pressure which is exerted by the blood on the inside walls of blood vessels. Now, normal blood pressure that is measured is actually 140 by 90 mm of mercury. That is the systolic is actually it is 120, but due to the sedentary lifestyle, 140 is acceptable systolic blood pressure, whereas diastolic must be 80 or at the most 90. So this 140 by 90 is considered as normal, but if it is more than that, then we can say that the blood pressure is abnormal, isn't it? Now, high blood pressure is a major health problem which is affecting most of the adult population also in most of the countries, and it is a major risk factor for death, isn't it? Now, as I said, it is also called as a silent killer, isn't it? Because it doesn't have any symptoms, isn't it? So, persons who are above 40 years of age must get their blood pressure checked regularly, isn't it? Now, this is more common in males than females, isn't it? Now, the types are also there, so we will see the types and the general symptoms are there. Actually, remarkable specific symptoms are not associated with the hypertension. Now, two types are essential or primary hypertension. In this, no specific factor and it is less common. So, in essential hypertension, the cause is unknown, whereas in secondary hypertension, some recognizable symptom can be seen, isn't it? There may be some disorder, isn't it? like it may be associated with the kidneys, or it may be associated with the endocrine system, or it may be due to pregnancy also in case of females. Now, if cholesterol is gradually getting deposited in the blood vessels, so that also may be the cause of hypertension. So that will come under secondary hypertension. Now, symptoms are headache, the palpitation, that is the heart beating that is increased, tiredness, isn't it? And lightheadedness. Then other symptoms, that is as we have discussed, like headache, shortness of breath will be there if the heart beating or heart rate is increasing, shortness of breath. Then there is nose bleeding also, isn't it? And there may be vomiting in some cases. Now, the risk factors also we will see, but before that, the complications of hypertension. So, complications of hypertension that may be associated with the various organs of our body. Now, hypertension increases the workload of heart, and as the workload of heart is increased, it uh, makes the walls of blood vessels weak, and because of this the arteries they become very hard, the elasticity of the arteries get reduced day by day, and there is formation of fatty layer or atherosclerosis inside the blood vessels. So the person who is suffering from hypertension, they have more chances of stroke, there may be hemorrhage, isn't it? Then there may be heart failure, isn't it? Coronary heart disease, coronary heart failure, LVH, that is the left ventricular hypertrophy, isn't it? Retinopathy related to the eyes, isn't it? So the vision may get affected, peripheral vascular disease, renal failure, that means the kidney may get damaged, hasn't it? Eye problems, that is the retinopathy, as I said, hasn't it? So these are some of the complications associated with hypertension. Now, the risk factors with hypertension are hereditary factor, family history may be there. Then persons who are above age of 40 years, that is the risk factor. Obesity, stulpana, mental stress and strain in life, high intake of salt, isn't it? Overeating, isn't it? Person eating fat rich diet, then habit of smoking, tobacco chewing, then consumption of alcohol, lack of physical activity, use of oral contraceptives. These are some of the important predisposing factors or risk factors with hypertension. Now, prevention, we will see the hypertension can be prevented by lifestyle modification also, isn't it? Like weight, isn't it? So weight must be controlled, then smoking, tobacco chewing must be avoided, then avoid drinking of alcohol, avoid table salt, that is high intake of salt in the food, then avoid fat rich diet, isn't it? So one must avoid excess amount of saturated fats, isn't it? Then there may be physical exercise in our routine life, isn't it? Then when the hypertension is detected in the early stage, then frequent blood pressure measurement after age of 40 years is very important, isn't it? Then if the lifestyle modifications are ineffective, isn't it? Or the level of hypertension at the start is high. So one may start the antihypertensive therapy also, isn't it? So anti-hypertensive therapy will include use of the various drugs like atenolol, nifedipine, clonidine, alpha-methyl dopa, isn't it? Or some patients are given combination therapy also. More than one drugs are given, isn't it? So the management of causes of tertiary hypertension are also necessary. So that is all about the hypertension. Next is coronary heart disease. Now there are number of causes of this disease, isn't it? And this coronary heart disease is divided into some other groups also. We will see that also, isn't it? This coronary heart disease is common in age group of 50 to 60 years, but persons around 40 years of age are also uh, having chances that they may suffer from this disease due to lifestyle habits and hereditary factor. Now, ischemia means inadequate blood supply to local area of heart. So, ischemic heart disease is one of the type of coronary heart disease. Ischemia means simply we can say there is a damage of the heart, isn't it? And that is only because the blood supply to the heart is not proper. There may be blockage, isn't it? Then this coronary heart disease we can define as acute or chronic form of cardiac disability, isn't it? So inability of heart to work normally, isn't it? So this may be because of the imbalance between myocardium, that is the main heart muscle, isn't it? And the imbalance between the supply of oxygen and demand of oxygenated blood, isn't it? Because of the obstruction that may be there, the deposition of cholesterol may be there in the coronary arteries. Now, risk factors. Now, this coronary heart disease may be in the form of angina pectoris, that is anginal pain, myocardial infarction, that is heart attack, cardiac failure may be there, or there may be abnormal heart beating also, that is arrhythmias. That may be high, if it is high uh, heart rate, that is tachycardia, low heart rate, that is bradycardia. Now, risk factors are the age, sex, hereditary, and race. Then the other are hyperlipidemia, that is the high deposition of cholesterol or lipids, isn't it, in the arteries. Then smoking and consumption of alcohol, hypertension, isn't it, family history, lifestyle habits, isn't it, mental stress and strain in life, then lack of physical activity, obesity, and if the person is suffering from diabetes, so he may have more chances of coronary heart disease. Now, control and prevention of this coronary heart disease at three levels we will see. So, primarily, one must avoid smoking and excessive consumption of alcohol. Then, the person also must control hypertension, isn't it? Reduce stress and strain in life. Then, maintain ideal body weight. He must control high body weight, isn't it? Then he must also control cholesterol level with low fat, isn't it? So how this can be done? So this can be done by increasing consumption of vegetables and fresh fruits in the diet. Then control diabetes. So intake of salt also must be restricted, isn't it? Then avoid stress and strain in life, isn't it? And the cases of coronary heart disease must undergo regular medical checkup also. Then secondary points under prevention are that use of sedative to reduce tension. So to avoid stress and strain in life, many times the person has to take some sedative drugs, isn't it? So that he must have calm and quiet sleep, isn't it? Then he must also use lipid lowering agents, isn't it? Like the example of the drug is atorvastatin. Then use of nitroglycerin, which will dilate the coronary blood vessels. Then the other category of drugs are beta blockers like atenolol, calcium channel blockers like verapamil, and sometimes the person has to undergo surgery also. Then the third one in coronary heart disease is rheumatic heart disease. Now this is little bit different uh, heart disease we can say, and in our India individuals who are 20 years of age also can suffer from this disease. Now this rheumatic fever, it is also called rheumatic fever. It is an inflammatory disease that occurs because of streptococcus pyrogen infection. Now, it is occurring due to the microorganism that is the group A beta hemolytic streptococci, isn't it? Now, it is the infection of throat, but it is not a communicable disease. It cannot spread from one person to another, isn't it? It leads to rheumatic fever, which damages the heart. These hemolytic streptococci damages the heart, isn't it? And it is a common cause of premature death, isn't it? Now, the other factors responsible for this disease are poverty, daridrata, undernutrition or malnutrition, we can say. So, if the proper nutrition, if it is not getting to any person or child, so there are chances that rheumatic fever may be there. Then overcrowding. So, when number of persons, family members are there, and when hygienic measures are not followed, due to joint family, poor sanitary conditions are there, poor hygienic conditions are there, and there are lack of medical facilities also. Now, clinical manifestations. So, clinically, what happens, as I have given you the description also, but still in the slide, same points are there, like inflammation of joints. Now, here it uh, rheumatic fever is a disease of connective tissues that are particularly in the heart and joints, isn't it? So, there is inflammation of joints, fever, then all layers of heart are involved, then CNS may be involved, subcutaneous tissue may be involved, and our skin is also involved, isn't it? So, carditis, there may be increased erythrocyte sedimentation rate, isn't it? Now, if blood culture is collected, so that also may show presence of beta hemolytic streptococci, isn't it? And as I said, the organs that are affected are heart, joints, and brain, as CNS is also involved, isn't it? Now, prevention is use of drugs, isn't it? So, the treatment with injection of benzathine penicillin can be given. Erythromycin also drug is useful in rheumatic heart disease, isn't it? Then the cases of sore throat in children's must be given penicillin, isn't it? Then the mass screening of children should be done in the schools, isn't it? Then general health education is also very important, like personal hygiene, isn't it? Good diet. So, socio-economic and living conditions of the public should be improved, isn't it? Personal hygiene also must be imparted, and the education must be given to the general public regarding personal hygiene, isn't it? And proper diet. Now, the last uh, disease in non-communicable diseases is blindness, isn't it? Now, the definition of blindness is the inability to count fingers in a daylight at a distance of 3 meters, isn't it? This is the definition. Other definition, we can say that a person is considered blind if his vision is less than 1 by 20th of normal vision, isn't it? Now, India, in our country, many people they are suffering from blindness, isn't it? And the general factors we can say are due to industrialization, malnutrition, poverty, and other factors that we will discuss. Now, causes in small children are congenital defects, cataract, that is motia bindu, abnormal enlargement of eye. In school age, xerophthalmia, isn't it? That is the vitamin A deficiency, malnutrition. Then in adult age, myopia, neurological disease, diabetes mellitus. So diabetes mellitus also, and even hypertension also can affect our vision. Now, the other causes which are associated with the blindness are some communicable diseases also, like smallpox, measles, that is gover, leprosy, kushtarog, trachoma, and sexually transmitted diseases. They can also give rise to blindness, isn't it? Then non-communicable diseases like diabetes, as I said, hypertension, isn't it? Tumor of the eye, cataract, motiabindu, glaucoma, that is increased intraocular pressure in the eyes, isn't it? They may be also associated, isn't it? Any injury to the eye can also give rise to blindness. Then the other factors already we have discussed, like malnutrition, vitamin A deficiency. Then the occupation of the person is also important factor. So persons who are working in industries, mines, they may get injury of the eye, isn't it? Then the faulty posture, then glare, that is the bright light or poor light, isn't it, can also give rise to blindness. Then many a times if some eye problems are there, so when the treatment is taken from the quacks meaning bogus doctors, so that also can give rise to blindness. So in this slide you can see the cataract, the person suffering from cataract, how the eye becomes motia bindu. Now, prevention of blindness we will see. So here, any discharge or any redness or pain in the eye should be taken seriously, isn't it? And measures must be taken to find out the cause and treated properly. Then whatever the eye diseases are there, those also like conjunctivitis, or if any foreign body that goes into the eyes, isn't it? That must be treated at the earliest. Then don't use anyone else towels or handkerchiefs. So common use of articles must be avoided. Then the exposure to the dust, that must be avoided. Exposure of our eyes to high light or dim light, that must be avoided. The proper care of the eyes must be taken, isn't it? Then complete treatment of eye disease is very important. Then The occasional doses of vitamin A must be given to the childrens or the persons who are suffering from blindness, isn't it? Then avoiding excessive stress on eyes is also very important. Then health education and personal hygiene regarding eye care should be given to the public. Then there must be special schools for the blind for their proper training, then rehabilitation of the blind persons, isn't it? That is also very important. So here we have completed the non-communicable diseases chapter. In this, in the syllabus, only four categories were there, like cancer, diabetes, then cardiovascular diseases, and uh, blindness. So here we have covered the chapter, isn't it? Go through these slides and complete your notes regularly and prepare yourself for the sessional exam. And this is the general tip that I can give you for the healthy life. So regular exercise is very important in our routine life. Then whatever we are eating, that must be healthy. So eat healthy, isn't it? Then reduce stress and strain. So the tension can be avoided in our life by following the yoga or light exercise, and always drink plenty of water, isn't it? So by drinking the water, our circulation of the blood is proper, isn't it? We get the oxygen in adequate amount, isn't it? So whatever the oxygen is there, that will also reach to all the parts of our body, isn't it? So these are general health general tips we can say for leading a healthy life. Thank you.